around Minnesota right now. Skies are partly to mostly sunny, but there's a storm coming. Snow and freezing drizzle with high winds. At noon in International Falls, it's snowing and 14. It's partly sunny and 16 in the Twin Cities, 28 in Appleton, and outside Arndt's Mug and Jug in Nicollet, Minnesota, it's partly sunny and 23. I'm Kathy Warzer with Minnesota News Headlines. The protests that have closed border crossings between Canada and the U.S. have moved into the upper Midwest this morning, hitting a crossing in eastern North Dakota. Tim Nelson has more.
The Royal Canadian Mounted Police in Manitoba report that trucks and farm equipment have parked in the road on Highway 75 leading to the border crossing between Emerson, Manitoba and Pembina, North Dakota. It isn't clear what motivated the blockage, but social media postings show tractors parked on the road south and northbound near the border checkpoint. That's been the case at other checkpoints where protesters have been calling for an end to Canada's COVID restrictions. The crossing is just over the Red River from Minnesota and is the main crossing for the Red River Valley area. U.S. border officials say all of Minnesota's 7 border crossings with Canada are still open for now, although the protests by Canadian truck drivers have been spreading. I'm Tim Nelson.
The chair of the Minnesota agency that licenses law enforcement officers says no-knock warrants should be banned statewide. Minneapolis police killed 22-year-old Amir Locke last week while police conducted a no-knock raid on the apartment where he was staying. Post Board Chair Kelly McCarthy is also the chief of the Mendota Heights Police Department.
I think citizens of Minnesota everywhere have a right to be safe in their home. And I think that a statewide ban really communicates to all of our citizens that we recognize that right and we will preserve that right.
The Post Board can set rules on training for SWAT teams. McCarthy says that process would take years, but legislation could be a faster route. There's a strike at one of Minnesota's largest suppliers of food for restaurants and schools. Teamsters drivers at the Cisco Western Minnesota facility in St. Cloud walked off the job last night at 10 p.m. Workers claim Cisco offers them wages and benefits that are far below the industry standard. With COVID-19 cases dropping off in all corners of Minnesota, mask and vaccine requirements are also dropping. Duluth will end its mask mandate this weekend, and St. Paul and Minneapolis are repealing their vaccine requirements for bars and restaurants. A number of Minnesota school districts are moving to drop masking requirements. Nationally, states like New Jersey, Connecticut, and Delaware are lifting mask mandates as polls show Americans are tired of COVID crackdowns. So are we at a turning point in this pandemic? We're going to put that question to one of the country's leading epidemiologists, Dr. Michael Osterholm, who leads the Center for Infectious Disease Research and Policy at the U of M. Welcome back. Dr. Osterholm?
Yep.
There you are. You know, one of the last times we chatted, you warned that we were still in the thick of a viral blizzard, and you were right about that. Are we down to flurries right now? Is the sun coming out?
Well, you know, we don't actually quite know that yet. And what I mean by that is that we're seeing in countries such as South Africa and in the United Kingdom, tails to that drop in the big spike in cases, meaning that it's not just coming back down to where it was before the spike occurred, but nonetheless, it's going to be much, much lower level of infections in our communities than we saw throughout much of December and January. So I think we're still not out of the woods in terms of having people hospitalized in our intensive care units, but I think that the ability to provide that care is going to be much improved over what it has been over the last 2 months.
Because we're still not out of the woods, but politicians are seeing the writing on the wall with Americans done with the restrictions, according to polls. Does lifting mask and vaccine requirements then make good public health sense?
Well, we have 2 pandemics going on right now simultaneously in this country and unfortunately throughout much of the world. One is the actual impact of the virus itself and the horrible toll it's taking on us. But the second one is a pandemic of lack of trust. And I think we're seeing that with governments. We're seeing that surely with the public health community and even to some extent in the medical community. And this latter one can be as dangerous as the virus itself because it means that this virus can do a lot of things that it might not otherwise do that we could prevent if people trusted what we have to say. And I think the challenge we have right now is we in public health have not done a good job of communicating what is the risk, what can we do about it, how can we lower that risk, and Then when will we put in place certain actions and when will we take them off? A good example is masking. As you have heard me say many, many, many times, the concept of masking to me is kind of like talking about any vehicle that may have tires on it. Well, I would argue that an ATV has tires on it and does a 747, but they're two very different kinds of vehicles. We talk about masking like it's one monolithic kind of activity. And the vast majority of people today that are using gaiters or face cloth coverings have very ineffective means of preventing transmission of the virus from that infected person or to a susceptible person. And yet we mandate that. And to me, I think until you actually determine how to get people to wear N95 respirators, these more tight face fitting masks or the KN95s, I don't understand the benefit of masking as a mandate, nor have I from the beginning. If we could do it with much more effective protection, then we'd have a leg to stand on.
Okay. But we're heading down this road at this point, apparently, as we see the mask requirements being lifted. Yet the unvaccinated, the elderly, and the medically vulnerable are still at risk. By lifting restrictions, aren't we setting ourselves up for another variant to come along like Omicron?
Well, we are in the sense that we want to protect the immune compromised, those who have underlying health conditions that would put them at higher risk for serious illness. And unfortunately, we are going to have to acknowledge they're going to have to do a lot to protect themselves. I wish we had another answer. And what I mean by that is they are going to have to understand who they're having contact with. They have to know that wearing an N95 respirator can do a lot to reduce their risk. And they have to know, of course, particularly if you're immune compromised, you have to have those 4 doses of vaccine on board, not just 3, but 4 doses. So there still can be that kind of protection. But the bottom line is a public health mandate only works if people are willing to do it. And what you're seeing is, in a sense, a general rebellion right now against this. Mammoth University just came out with a recent poll, a very well done survey, where fully 70% of Americans now agree with the statement that it's time we accept COVID is here to stay, and we just need to get on with our lives. You can't, in a sense, create mandates that are highly successful or that people will comply with when you have that kind of attitude. And so I think we're back to the drawing board to say, okay, we're now here at this time where case numbers are going to come down dramatically. But you know what? Another variant could show up tomorrow, and that could be just as bad as Omicron. Will we even have any credibility left to get people to maybe do certain things so that we don't overwhelm our healthcare systems? What does that mean? And I think we don't have good answers for that right now, and that's our responsibility to have those answers.
So how can we transition then from pandemic to endemic in a careful way? Or just given the politics of this country, is that impossible?
Well, let me answer. There's 2 parts to that question. It's a very important and good question. Number one is I don't have a clue what endemic means. I've written a book on epidemics, pandemics, endemic disease. I've written many, many articles about it. Endemic implies that, in a sense, it's now become just a normal part of everyday life. But let me just take us back a year ago. It was a year ago this very week. I said publicly that I thought that the darkest days of the pandemic could still be ahead of us. And even though vaccines were flowing and the case numbers had dropped precipitously from that early January peak, and that was because I saw what the variants were doing. Already we had the alpha variant, we had the beta variant, we had the gamma variant. And I looked at that and said, well, what would keep additional variants from occurring that could basically evade immune protection or could be much more infectious? Well, you saw what Delta and Omicron brought us in the next year. I see that same potential still being there going forward, even though we have higher levels of vaccination, which have been critical in reducing severe illness, hospitalizations, and deaths. I still maintain we have a pandemic of the unvaccinated, because if you look at the number of people who have been seriously ill, who have died, it still is largely among the unvaccinated. But so the point being, though, we could have another variant come out that, in fact, causes us to have to reconsider what are we going to do again. And then finally, I think that from the standpoint, that second point is what do we call a disease that is a real problem, then kind of goes away for a while, but then comes back as a real problem. Do we go from a pandemic to an endemic, back to a pandemic? So the point I'm trying to make here is this is all semantics. What we need to come to grips with is we're not done with the virus. It's not done with us. Unlike influenza, when you have a new pandemic, influenza virus occur, it jumps from animals to humans, it stays in humans, and with humans, eventually that virus becomes basically a milder virus infection. It becomes part of seasonal flu. We've watched the SARS-CoV-2 virus jump to a many animal species. We've talked about the issue of the white-tailed deer infections, which has been remarkable. Now we have a whole new reservoir, a term we use to call where the virus might reside, where the mutations can occur. And it would not surprise me a bit that we would see more spillbacks from the animal population to humans again. So I think there still are real challenges with this virus that we just don't understand. And if there was ever a time for us to have great humility as scientists and public health practitioners, it's now to say, I hope that in fact we don't see more variants emerge that can be really problematic. But as I've also said, hope is not a strategy. And at the same time, if they do occur, are we prepared for them again? What are we going to do better next time than we've done for Omicron, for example, which has literally broken many of our healthcare systems around the country?
I know you have another interview. Thank you so much for your time.
Thank you very much. Take care.
You too. Michael Osterholm leads the Center for Infectious Disease Research and Policy at the University of Minnesota.